Welcome back. Imagine walking around knowing that your body, specifically your heart, is literally a ticking time bomb. Well, for the millions of Americans who got the COVID jab, it is. After years of denying the truth of heart complications from the shots, Pfizer admits that, quote, myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the lining outside of the heart, have occurred in some people who have received the vaccine, more commonly in adolescent males and adults under 40 years of age than among females and older males. In most cases, the symptoms began within a few days of the second dose. The chance of having this occur is very low, end quote. And even if it does occur, according to the CDC, it will go away with few complications. Except, of course, for that pesky complication called death. According to the world-renowned Mayo Clinic, certain arrhythmias can cause the heart to stop beating, sudden cardiac arrest. It's deadly if not treated immediately, or also known as sudden cardiac death. So, of course, the CDC has tried to disconnect the shots from the deaths based upon new reports, according to their media propagandist, NBC News. So the shots cause myocarditis. Myocarditis causes death, but the shots don't cause death? Wow, that's got to be the dumbest attempt to disconnect from the truth that I've ever seen. Cardiologist and Chief Scientific Officer of the wellness company, Dr. Peter A. McCullough, MD, joins us now to discuss. Dr. McCullough, thank you so much for being with us. It's great to have you back.
Thanks for having me.
Well, doctor, the CDC is finally admitting that the shots cause myocarditis, but of course, they're downplaying everything about it, from the rate of occurrence to patient profiles and, of course, the threat of sudden cardiac death. I'm curious to know, in your practice, how often are you seeing it, and in what ages of patients?
I'm seeing myocarditis on a weekly basis now. Prior to the COVID-19 pandemic, I saw 2 cases my entire career.
Wow.
Rose and colleagues, I'm senior authors, reported over 3,800 well-characterized cases from the VAERS database. 2.9% are fatal. And now Hulscher and colleagues, again, I'm senior author, report on autopsy-proven vaccine myocarditis that's fatal. So any report that tries to reassure America at this point in time has to be viewed as basically not being valid.
Wow, very concerning. And of course, too, they're just pretending like it just goes away after a few days. But isn't this a chronic life-threatening condition?
There are some late cases now, even 2 years after the shots. In the Rose paper, the standard deviation, even for those being reported in VAERS, which is an acute reporting system, is 195 days. So I can tell you, in the CDC report from the Oregon death certificate study, they truncated the data at 100 days, and they only had just a handful of people had even taken the vaccine within 100 days. So the CDC Oregon death certificate study is definitely not valid. It should be disposed of. We should be worried about every person who dies after the vaccine when there's no antecedent illness and no other, obvious explanation for why they died.
Yeah, absolutely. Is there any way for patients to be diagnosed with this before actual cardiac arrest, and is there a cure?
About half of individuals have some symptoms, so people have to pay attention to symptoms, see an internist or cardiologist, exam ECG, blood tests, including troponin, BNP, galectin-3, cardiac ultrasound, and then a decision on whether or not an MRI should be undertaken. I think we should play it safe and conservative and assume the vaccine is causing problems as opposed to, in a sense, brushing it off.
Absolutely. Well, in addition to the shots causing cardiac arrest, you have a new Substack out about pseudo-ordinated mRNA shots causing cancer. These are the shots that keep giving, aren't they? I mean, what do we need to know about this one, Dr. McCullough?
Recall that Pfizer and Moderna electively decided to replace all the uracil, the natural base pairs and messenger RNA, with M-pseudouridine. That's the change that Kariko and Weissman won for the Nobel Prize. Now this report out of Mexico suggesting that this change probably makes the messenger RNA cancer promoting. It actually probably directly causes cancers. And in this paper, they are strongly warning the companies making cancer products for messenger RNA not to do this modification, because the cancer treatment may make cancer worse instead of better.
Wow, terrifying stuff, just incredible. Well, I think we all know at this point, or at least those of us paying attention know, things are likely going to get much worse for our lives if the WHO gets their pandemic treaty powers passed. The upcoming meeting is in Geneva, May 27th through June 1st. And ultimately, what we need to know here is that we would lose our national and individual sovereignty. Think COVID crackdowns times 1,000, right? They're just looking for anything to call the next pandemic, right? I mean, we will be forced under their digital passport, and they will have control over our movements and really everything we do with our lives, right? Why aren't more people talking about this? I think this is a very alarming issue. And how do we get more Americans to wake up to this impending doom here?
It's because those who are going to represent the United States have been so quiet. Listen to this. We have Lois Pace from the Health and Human Services, John Nakwasong from the State Department, Atul Gawande from USAID, and Paula Hamamoto from the State Department. Lois Pace, as an example, has fewer than 10,000 followers on Twitter. When she tweets something, it's less than 24 people ever retweet it. These people are basically unknown. They're government staffers. They have no accountability to America, and they haven't told us how they're thinking on this. I would not trust any of these with the future of America's healthcare. These people need to be exposed. We need to have pressure put on HHS, the State Department, and USAID. The world is rejecting this power grab by the World Health Organization. We've seen huge demonstrations across Europe and now Japan. And so I can tell you as a doctor, I soundly reject the World Health Organization. If this is what the Biden administration is going to bring us, I think it's going to bring that administration down at the time of an election.
Yeah, it is should really just alarm every single American, regardless of what end of the political spectrum you're on, because it will inevitably affect your life in a terrible way. It's not good. And I think the fact that Biden staffers are the ones in attendance there is pretty telling. Very interesting. Thank you for sharing that with us, Dr. McCullough. I think some people are waking up to the medical tyranny game that's going on relentlessly here. And gratefully, there's a lot of parents who are privy to this information. There is a new report out that they are delaying the shots, but that it's alarming to pediatricians. I'm curious to get your thoughts on this, Dr. McCullough. What exactly are they alarmed about? I mean, the children's health or the loss of control of an experimental group?
It may be the loss of revenue. Pediatricians get special bonuses for getting a percent of their panels vaccinated in so many various payment schemes. At this point in time, there's 5 studies showing that children are healthier if they actually decline all the vaccines. The parents decline the vaccines and then selectively consider vaccines as they move forward. Now, a child who has congenital heart or lung disease, cystic fibrosis, other conditions, the vaccines could be more compelling. But we don't have threats of diphtheria or pertussis anymore. We treat that with a Z-Pack. We have other issues. Largely, the infectious diseases of the past have been handled with improved sanitation. None of the vaccines are sufficiently effective or safe. And we now have, a rising concern that excessive vaccination is related to allergic diseases, neuropsychiatric disorders, and a whole variety of problems later on. So this can all be avoided by going natural at this point in time. That's advised by the World Council for Health, international body. Go natural and then selectively choose vaccines as the child develops.
Very interesting stuff. It is amazing. I saw a graphic recently of a baby with all of the injections that are now recommended. The whole body was filled up. It's just terrifying to know what is actually being done to these innocent children. So yes, parents need to be doing their research and standing up for their children. Crazy stuff, Dr. McCullough. I also wanted to get your thoughts on this because I know you've been speaking a lot about it recently. This year's panic porn is the bird flu. But I'm curious, how could it be a problem if they've been injecting our poultry with a vaccine, right? What are your thoughts on this latest fear campaign going around?
Our research on this McCullough Foundation, we found out that, in fact, bird flu has been around for decades. It's been, an age-old problem. And what's happened now is there's been mass vaccination of poultry outside the United States for over 20 years. That's making the problem worse. Now the virus is mutating, it's spreading to other, other forms of fowl like ducks that can fly, fly elsewhere. We had a man in Texas develop it from cattle. So it turns out that vaccination of poultry is backfiring, and now it's threatening the food supply, because if the virus infects the poultry, a method of managing it is actually culling. That's destroying the chickens. And recently, Ag Commissioner Sid Miller in Texas called for the slaughter, basically, of millions of egg-laying chickens in West Texas to try to control bird flu.
Amazing. Imagine that. Vaccines, not great for humans and apparently animals too. Dr. McCullough, thank you so much for all the great work that you do, and thank you so much for joining us today. I really appreciate it.
Thank you.
For all our viewers asking where One America News is heading in the future, we would like to introduce you to OAN Live. OAN Live is the best way to stay up to date on all of the hard-hitting, straight-shooting, national and international headlines. And the best part is, OAN Live is only $4.99 per month. All the credible, honest, unbiased reporting One America News offers at a fraction of the cost of cable. Just go to OANN.com to easily sign up for OAN Live and stay informed.